Everybody, hello. My name is Dara. Welcome to our Merry and Mindful Live. We're excited to just go over some of the things to be mindful of as we head into the holidays. I have Maura with us. So Maura, you all probably recognize her from the portal. She is amazing and so excited to have you on here for your first Provider Live.
Yeah, so I am a nurse practitioner with 5410. I've been with them as a provider for a little over a year and a half. And I've been with them as a patient for a little over a year. So I'm also on my own GLP-1 journey, and I love helping all you guys and helping everyone on their own journey. So I'm excited to get into some fun stuff with you guys.
Yes, thank you. Yes. I'm super excited that you've been so helpful with my own journey since you're on it. And I think that makes such a huge difference just to be able to, understand the patients a little bit better. Obviously, as an NP, you have a whole other side of things that you're helping with patients as well. But to actually be on it, I think makes a huge difference. So do you want to talk about your journey a little bit? You've been on it for about a year, so a lot of these things we're going to talk about you've actually gone through yourself, which again I think is huge for patients. Do you want to tell us a little bit about that? You've been on it for a year, so like what part of the journey are you on? Obviously not your first 9 years. So
Right. So this was like my second time on it. So I have been on branded before years ago. I started with compounded semaglutide with 5410. I switched over to compounded tirzepatide. Had great luck with both drugs. I'm currently in a maintenance phase off the medication. So I wean myself off and I'm maintaining without it for now. So I've kind of done the weaning off phase as well,
which looks different to everybody. I'm excited to get into that. Okay, so just to kind of go back to the original, like starting out, not being on it ever, not just being new at 5410, but being new to a GLP-1 in general. As you know, getting into those first couple weeks can be a little scary. But let's talk about the jumping into it, making that decision to get on a GLP-1. Some of the things that might prohibit somebody is the side effects. Do you want to get into some of those early side effects and kind of how, as a provider, you help our patients navigate that?
So everyone responds differently to the medication. So some people go on it and are able to titrate up and they get to their goal and they literally have no side effects. Those are like the unicorns, which is great. But some people do have side effects initially. And so we do expect some GI side effects initially. Nausea is probably the most common side effect that people experience. Like I said, it's different for every person. If you're somebody who gets nauseous normally, just through your day-to-day life, the medication might cause you to be more prone to that. But the way we prescribe and titrate up is very personalized to you. So if you're having side effects that is preventing you from going up, you can reach out on the portal and we can kind of help you to say, okay, maybe you're not ready for a full dose increase, but maybe you can go halfway. And so we can really help you on the portal how to personalize the medication to you so that you can tolerate it. Yeah. If you're having side effects that are interfering with your day-to-day, then it's probably a sign that you are not ready for an increase yet. Most side effects should get better with time as you are on the medication. Those beginning doses in those first few months are going to be to get your body used to it so that you don't have any really bad side effects that are going to interfere with your life. As I say that, I do want to mention constipation. So most of the side effects should get better with time. Nausea should get better with time. Gas, diarrhea, those type of side effects should get better with time. Constipation is a side effect that if you don't address it, it will not get better with time. So if you are experiencing constipation, please start taking a fiber supplement. That's generally our first go-to. If you start feeling constipated, you're not having your normal routine as you were before, start taking a fiber supplement. If that doesn't help, you can reach out on the portal and we can kind of see what the next step should be. But constipation is not a side effect that goes away with time. It's something you have to address in order to get you on a bowel pattern that is going to be tolerable for you moving forward. One of the ways this medication works is we slow down the gut. So we're slowing down the way food enters and exits your system. So constipation is expected, but you still have to address it so that we're not slowing it down too much, and then we run into some issues there. Yep. So if you're ever having constipation and you cannot get on a supplement that's helping you, there's a lot of different things out there. Usually my go-to is fiber gummies, Metamucil. There's so many different things you can do. If that doesn't help, you can do a stool softener like a Colace. A lot of people in the portal and on GLP-1s love Mago 7. So yeah, so that tends to work for people. There's Senna tea. So there's different things you can do, and everyone's going to be different into, what works for them and what works for their body. So as far as side effects goes, it should get better, but constipation, we got to address it or else it's just going to continue.
Yeah. And I think it's so important, something that you touched on, and I know that we drill it all the time, whether it's in the portal actually, and we're just reiterating that, but we are always pushing people to the portal. Don't diagnose yourself, even with these types of things. So like you're talking about constipation, getting on a supplement, something like that is great, but make sure you're always reaching out to the portal, because that could be something that actually is, I need to drink more water. There's so many things that I was like, oh, this is normal. But then once I talked to our providers, our nursing team, it was like, oh no, that's not normal. You need to fix that right now. And, what you think might not be actually what we would recommend for you to do. Maybe it's, something that I maybe don't even think is an issue, like constipation and not going for X amount of days. Definitely reach out to the portal. So constipation is definitely one we see all the time in our community, and, in the app, social media, all of that. But one thing that I did not realize as I was in my first, 90 days was that it is not a good thing to not eat. So what are some of those first signs that the medication is working? I then want to get into how to know if it isn't, and some of the side effects thing doesn't mean it's not working, but
sure. Yeah. So side effects are possible. Just because you don't have side effects does not mean it's not working, because the goal is for you to not have side effects. But some of the first things you're going to start feeling if you're new to the medication is usually it's early satiety. So where before you would fill up your plate and you'd want to go for seconds, maybe you fill up your plate, you eat it, and I'm feeling full. So usually it's early satiety or early fullness are going to be the first signs that things are starting to work. And, with anything, it's going to take time. We got to, get on it, let your body get used to it. We might need to go up in dose. The goal is not to not eat, like you said. That's actually not the goal at all, because it's not sustainable. You're going to lose muscle. You're going to lose your hair. You're going to lose bone density. Those are all things we are not looking to do. So, I'll have people on the refill forms, they'll be like, it's working, but I get hungry on day 6. I'm like, well, actually, that is working very well. The medication is going to wear off as the week goes on. So the goal is not to have you completely not hungry all the time. Or somebody will say, I'm not hungry, or I'm hungry still. You still need to be hungry. The goal is to still eat, but to be satisfied with smaller portions and to not be thinking about food and snacking all the time.
Yeah.
You still have to be eating and reaching your minimum calorie goals. And if you're not doing that, your goal is too high. In the beginning, you're going to feel that early fullness, early satiety. You might have some side effects. Hopefully they're mild and manageable. If they're not mild and manageable, then you can always reach out on the portal and we can kind of help you talk through, are those side effects okay? Or do we actually need to go back down? Even if you're on the starting dose and you're having nausea for 4 days, I'd probably go down a little bit on that patient because I don't want you to feel like that for 4 days. And your body might just need a few more weeks on that lower dose to get used to it. And there's also like so many tips we can give for like how to manage nausea without a medication, or if you need a Zofran medication being sent into your pharmacy, we can do that and see if you qualify for that. Yeah, those beginning doses are to help your body get used to it and to, start feeling that early fullness. Like that's when we know, okay, I like this, right? Like, we can start talking about increasing and what that all looks like as well. So yeah, I think that is so helpful in some of those things that you may not even realize you need to be reaching out for so that we can help. At what point should patients be reaching out to the portal when it comes to nausea? Everyone experiences nausea a little differently. And so if it's interfering with your day-to-day life, and if you feel like you need Zofran or something to get through your week, reach out so we can either help you get that, or if you're on a medication to where you can't take Zofran with it, then we can kind of give you other tips. Nausea, I'm usually okay with as long as you can still eat and still drink for about 2 days. If you take the shot and you're nausea that day and the day after, but you can still eat and drink, then that might be something that you can work through and get used to it. But I mean, if you're like, I'm nauseous, I hate it, we can always back down, like you can always reach out and we can say, this is okay. But if you're feeling nauseous for 4 to 5 days and you can't get out of bed, like the medication's a little too high for you at this point and we need to back down. It's really patient to patient, the way, everybody kind of experiences everything.
And we do have a really good, in our patient education, we will send that over. Here are, common side effects and when to reach out. So make sure to read everything in its entirety. So that's perfect. Like I said, I know a lot of people I was one of those people that was like, oh, I've heard that, I'm going to be nauseous the whole time. My head's going to hurt. And it kind of delayed it a little bit more for me. So yeah, I think that is really good. Things to look out for, and always reach out to the portal. They're here for you. Okay. And then, so getting into kind of that next phase. So the refill process. So what are some things when somebody is like, okay, this is working. I've finished my first 90 days. Now I'm ready for a refill. What are some of the things that you're looking for as a provider as you review everybody's form and then the next kind of phase for you for getting that refill submitted?
We want to see that you're tolerating it well. So we ask some key questions on those refill forms. I know some patients get frustrated. They're like, I filled this out last time. Why do I have to do it again? Well, because we need to check in. We need to make sure you're tolerating it well. So are you having good appetite suppression? Yes. All right. Sounds good. You're on a good dose. Are you having to force yourself to eat? If that's yes, then we're too high. You should never be forcing yourself to eat. Now, I do have a lot of patients who mark yes, and they're like, well, I have to remind myself. That's okay. The fact that the food noise is gone is great. But if you mean like physically force yourself to eat, then we would probably want to back down a little bit. But if you're, you have good appetite suppression, your side effects are tolerable, you have, nausea for a few days, or maybe you have a GI side effect for a day out of the week, that's okay. So we want to make sure you're tolerating it well. Any signs of vomiting, I definitely always touch base with the patient on that if they mark vomiting as a side effect. If you vomited once when you first started, but now it's never happening again, that's okay. But weekly vomiting, never okay. I mean, that's never okay. You're going to risk hurting your teeth there, throat issues, and you might risk being dehydrated. So vomiting is never okay. But if you vomited once when you first started, that's right. So we want to check in on all things and make sure you're feeling good on the medication. Your side effects are mild and manageable for a few days, and then if you're ready for an increase or not. Now, obviously, this depends on the patient's goal. So if you had somebody who only needed to lose 20, 30 pounds and they're close to that, then they might be close to maybe one more program and then they're going to wean. Or we might have somebody who they're down a little bit, but they have quite a ways to go. So that's really, the first refill and everything, it's really going to depend on the patient's whole journey and what that looks like for them. If there's somebody who has quite a bit to lose, we would like to get them on a dose to where they're kind of coasting, right? We're on a dose that's working. They're losing 1 to 2 pounds a week. They're really tolerating it well. They're not having a ton of side effects, and they're still losing weight. They're not having to force themselves to eat. So that is like the goal dose. That dose is the dose that you should stay on for as long as you can until it doesn't work. Some patients think we should, increase automatically, because on a lot of our programs, the prescriptions do kind of auto increase because we give you that option to increase. But we also always include in that, stay in the lowest working dose. Now, I don't think people always see that or get that. But if you're on the second dose increase and you're feeling good, you're losing weight, your appetite suppression is great, stay on that. It's going to make your program last longer, which is more economically supportive for the patient. And we're going to prevent side effects. So with every dose increase, you might have kind of an increase in those side effects. So say you experienced nausea in the beginning when you started, and then you're on a dose and you're going to increase. I would expect maybe that nausea to come back a little bit for a few weeks with every dose increase. Generally, that's where we see those side effects kind of happen again. So don't increase if you don't have to. The goal is not to get to the top. Many patients have to get to the top because that's how their body's responding and that's what their body needs. But once you get to the top, our wiggle room is gone. So obviously, depending on what medication you're on, we can always, switch medications or help you by increasing protein and different things to break a stall when you're at the max. But the goal is to not max out. If you have to max out, that's okay. But you want to stay in the lowest dose possible for as long as you can. Now, I say this, and knowing this, when I was on mine, I had a goal date in mind. So, I definitely ramped up my own medication and I ate my own words. You know what I mean?
Right.
So,
I think we all do. I'll have a headache throughout the day. I'm like, why does my head hurt so bad? And it's oh, I didn't drink enough water today.
Right. And
the things that you
I can say these things till I'm blue in the face, but I still have to eat my own protein. You know what I mean? So stay on the lowest working dose for as long as possible. A, it's cheaper. B, your medication will last longer, and C, you're going to be able to feel good in your day-to-day life and try to avoid those side effects with the higher doses.
Yeah, I love that. And I think something to touch on with that as well is, yes, I was one of those too that, race to 15 milligram. And I see that a lot as well in our patients. I'm sure you do as well in the portal and things like that, where it is, at what dose do I need to be at for me to really start losing? And it's that's not how it works. You do not want to race to 15 milligrams. Even if it's not 15 milligrams, it's just, what dose is it that you lost the most? We hate seeing stuff like that, especially when it starts to be patients, reporting on those same things with each other. And then they start working out, oh, okay, then I'm going to bump up then, and they start working out what their dose should be amongst each other, as opposed to just saying, oh, it was I hit my sweet spot at 7.5 to 10 or whatever that looks like. People are taking that as, oh, I need to bump up as soon as possible. Then when it's the ones that really are, I love seeing the ones that are I have lost, 60 pounds and I didn't go up a dose at all. I'm still on 2.5. So those are really important things to know as you consider getting into a GLP-1 or, just.
It's really hard not to compare, especially with social media and all the things that you can see, which are great resources. It's so awesome we have these resources. But everything you see and read, you do need to take with a grain of salt. Just because that person was on this dose does not mean you need to be on this dose. I have couples that are like the husband and wife are both on it, and my husband's on this dose and he's doing really good. Well, okay, that's amazing. I love to hear that, but you may lose on lower, so like really comparing doses. Everybody's different in how they're going to respond. So, you're going to compare, you're going to say, what do you want? What are you doing? I want to do that. But it really is, this is so personalized to you. And the way we have our medications, because we draw them up and we have vials that we can draw up a dose for you and we can give you a personalized dose. Really, we can give you the exact dose that you need to be in that sweet spot, lose weight and not have side effects. So everybody in the app and everybody talks and that's awesome. That's part of the community. But like comparing someone's dose to yours is like, it's comparing apples to oranges because everyone's going to respond a little bit differently.
Especially husbands, by the way, like just my husband will look at us and he's lost 12 pounds, so it's like, definitely not husbands.
They lose weight way too easy.
Yes, never. And it's also interesting, like between people, same households eating the same things. My husband had really bad sulfur burps. I thankfully never had that, but it's just it's so interesting how everybody reacts and responds differently. But we do have those guidelines for you as well in your portal, so you can. And always reach out. We are there. Okay, so you touched on it a little bit, but about plateaus. So within that, like, you're not in maintenance yet, but you're still trying to, you still have your goals in mind and everything, which is something to kind of touch on back on the first part is setting goals. How do you do that when you are on a GLP-1? Because for me, again, we'll go back to me. I just wanted to get under, 220 pounds. Then it was under 200. So now, losing almost 120 pounds, it's like, it was so hard. And it still is hard for me to kind of figure out where do I stop? So moving into this next phase of after, you've been on it, you're 90 plus days into the year, 6 months plus into year, we've got patients that are, pushing into the 2-year mark now. So how do you kind of know I'm still trying to lose or do I need to lose anymore? Kind of talk me through when you start deciding, okay, I think I'm starting to get into maintenance or I'm getting closer to my goal, whatever that looks like.
Yeah, so I think we're talking about two different things here. So we have the people who are plateaued and say they're on the max dose and they do want to lose more. And then we have the people who don't know their goal and they're just like, when do I stop?
Yeah.
So as far as plateaus, if you're on, say you've been on this medication for a while, you are on the max dose. So say you're on the max dose of tirzepatide. Generally, if someone was maxed out on semaglutide, we could switch them over to tirzepatide. So say you're on the max dose of tirzepatide and you've plateaued, you haven't lost in 2 months. Generally, a plateau is no weight loss in 2 months.
Okay.
And then, so first thing we're going to do is talk about all the lifestyle modifications that you can make that maybe we can tweak something to kick you out of that plateau. Yeah. The easiest thing to kick people out of plateau generally is to increase their protein. So make sure they're hitting their protein goals. Make sure that we are at the ideal amount for a calorie deficit for their body. So your height, your weight, your activity level, we're not too low. Sometimes not even eating enough calories can cause you to be plateaued because your body's like hanging on to what it can hang on to. So kind of honing in on that. Make sure you're getting your water, your fiber. Are we doing any physical activity? Have we checked our labs recently? Are we getting enough sleep? How's your stress? So those are kind of all the things we want to kind of check on to see before we do anything else. I like to check on those things and see where we're at. But say this person has already done those things. They're coming back to me again. They said, I increased my protein. I was at 90. I increased by 10 grams. What can I do? We can kind of play with the dose a little bit and see if somebody's on the max dose of tirzepatide. Sometimes I will drop them down a dose or two and help them with those lifestyle modifications. Part of the way the medication works is it works on the reward center of your brain. So it helps you not crave those foods. So sometimes while it makes you not crave those foods, your kind of drive for activity or exercise can be down on that max dose. So sometimes if I have a patient saying, I just don't want to work out, like I just don't want to, well, if we can try to go down to 10 for a little bit, go down to 10 milligrams or 9 or 10 milligrams of tirzepatide, really focus on those lifestyle changes, see if we can get into somewhat of a workout routine, because we know that those who work out while they're on the medication do better off the medication as far as sustaining weight loss. So we want to kind of keep up some type of physical activity while you're on it. So drop down to 10, see if we can hone in on those lifestyle modifications. And then that gives us somewhere to go up again to try to break a plateau. So I think another thing to kind of bring up here is the goal, like you were saying, initially you were just like, I just want to lose some. And you didn't know your goal because you didn't know that you could be this healthy at this point. And I understand that. I get that. It's like, I don't know. I just want to start losing because there's no way I'm going to be this weight, if you would have told yourself, I don't know when you started your journey, but 10 years ago, you're going to be this weight, you would have probably been like, how,
Yeah. Yep.
So kind of seeing where that goal came from. So if I was somebody who, when I look at them on paper, they seem to be they're healthy BMI, they've lost a significant amount of weight, they seem to be doing the lifestyle modifications that we recommend for maintaining, but they just can't get to what their goal is. Sometimes it's a tough conversation to have with people and say, where did this goal come from? Have you ever been at that goal in your adult life? Which doesn't mean that you can never, because, if you've been overweight your whole life, that's, but it's just kind of getting information of where did this come from? Was this number a number in your head from 8th grade, or something like that? Because you want your goal to be attainable and sustainable. Maybe this person is maxed out, they're trying to lose 5 more pounds because they think that number is the number that they should be. And truly a number on a scale is just a number. Sometimes I find that patients want 5 more pounds, but they're really aiming for a more aesthetic look in their body. They want more of a toned look. So can we try to maybe add in weight training and weights to see if backing off of the dose, forgetting about weight loss for a minute and thinking about your overall health. And it might be that they actually want to gain muscle versus lose weight. And that can be kind of a tough conversation to have with people. But, just kind of seeing, where were you when this number came about? Tried to get there, on the max dose. You do want to get to a goal that is sustainable. Yeah. Because, and some people, they're like, I'm going to be on this medication the rest of my life, that's, on a maintenance dose, and that is totally fine. But there's also some people who are like, I don't want to be on this forever. So you need to be at a weight and at a place that you can sustain long-term, whether that's on a maintenance dose or whether that's off the medication. I mean, I've done this with myself as well. I was kind of where you were at, where I was like, I just started taking it. I didn't have a goal. I mean, I didn't feel out of form, but, but I was like, I had a weight that I had, never been at in my adult life. So I'm like, I guess that's kind of my goal. And then, once I got there and I wasn't losing once I hit it, I'm like, okay, well, I've plateaued a bit. I know I'm hitting all these things. So that's why for myself, and this is my own personal journey, I've weaned off so that I could work on some lifestyle modifications with the intention of I'll probably get back on at some point, but just to kind of see what my body does if I focus on this thing and this thing being off. So
with all of that being said, if not the most important thing that I've learned through this journey is listening to myself and my body. How am I feeling? Something we preach nonstop all over the app and social media is those non-scale victories. Yes. And I think that makes such a huge difference in those times where you are stalling, you're not losing anything. How are you feeling? Are your clothes fitting? All these little things that sometimes you don't realize until you're at the end of it, or actually getting those tips from the providers and things like that. You don't even think because you've never felt those things before. Like food noise, that's foreign to people. Talked about NSVs. So yeah, and I know that that's something in the portal too. Oh, you talked about labs. Labs is one that, you maybe don't even realize until you get that checked. So like B12 being an issue. Yeah. I just think I'm tired and stressed. Like I don't realize that it's an actual deficiency that I wouldn't have realized if I didn't reach out to the portal and get that guidance.
Sure. And right now we don't require labs for a refill. That kind of changes as time goes on. But just as a general rule, most people should have labs done at least once a year, especially if you're on a GLP-1 every 6 months to a year. It's a good idea to check in. This medication is filtered through your kidneys. We want to make sure your kidneys are still working well so that you can be on the safest regimen for you. So we don't require them right now for refills or for starting. But just as a general rule, some people need them more, some people need them less, but every 6 months to a year is really good to check in and see where, are my kidneys working well? If I was pre-diabetic before, where am I at now? To look at your A1C. So definitely checking in on labs. If you're stalled, how's your thyroid? Is our thyroid working okay? Are you on, the right dose of your thyroid medication? So all things that we need to check in on. And we try to touch base with whenever I have a patient coming through who's on a thyroid medication or something. I'm always checking, make sure your provider who prescribes that knows you are losing weight because that dose may need to be adjusted. So things like that. So definitely good to check in.
So as far as maintenance goes, for somebody that does not have that goal, the weight in mind, that number in mind, for you were talking about a date. If you are looking at somebody that overall looks healthy, like you said, maybe they're within, that 5-10 pound mark when they look at their BMI. I'm using myself as an example. I'm barely in that overweight. How do you help somebody in that phase? So for me right now, I am ready to start looking at maintenance. What are things that I should consider, whether I need to be on it for the rest of my life or just short term? What are some things that you look at to work with someone like me?
So, being close to goal or not knowing goal, BMI is such sometimes it's good, sometimes it's bad. We have to have something concrete to look at, but a weight that you can sustain long term and you not feeling like you are killing yourself to maintain. And, if you're okay, am I going to be on this forever? Do I need to wean off? Generally, we see the higher the BMI starting is generally when people need it long term. So greater than 30 BMI kind of qualifies for long-term maintenance. Now that's a little different with every patient, and there's people who have a higher BMI than 30 who are able to come off and maintain without it. And there's people who are a little bit lower who really struggle maintaining without it. So like you said, it's very patient dependent. But if someone says, I'm ready to start maintenance, generally what we'll do is we'll slowly wean their dose down. So if someone's ready to come off, I like to wean them off over 2 to 3 months, a slow wean, so that they can kind of feel the way that food noise, it does come back and your hunger will come back. but the slower you can go off, the more sustainable it is. I definitely don't recommend stopping cold turkey. You want to wean off. So over the course of 2 to 3 months is really the ideal wean.
Okay.
There's also people who maybe they start to wean. And if this is something you would want to consider, I don't know. But if you're like, okay, I want to try to wean and see how I do, and say you get down to a dose and you're like, I just don't think I could go any farther. Well, then that might be where you're finding your maintenance doses.
Okay.
So whether that's 5 milligrams, 6 milligrams every 14 days, or way you can kind of individualize it to you is going to be different. But generally, when someone's weaning off, we'll take their current dose, we'll space out the injection a little bit. Instead of taking it every 7 days, take it every 10. And then you can kind of wean your dose down from there based on either milligrams or units. And we can kind of help you do that. But, if you're ready, if you're feeling like, I'm happy where I'm at, I want to try to wean off and see how that goes. Then you can, wean off and see how you do. And if you get to the 4 milligram mark and you're like, I feel great at this dose, I don't have inflammation, my hunger's come back a little bit, but I'm able to control myself and sustain based off the lifestyle modifications I made while I was on it, which is key too, making these lifestyle modifications while you're on the medication, while the medication is controlling the food noise, is so key for sustaining long term.
Okay.
The first time I was on branded in between my 2 pregnancies, I was on it short term on a branded GLP-1, and I did it knowing I was gonna come off so that I could get pregnant. And so I stopped cold turkey. And that food noise comes back. It does.
Yeah.
And then I got pregnant. So, pregnancy food. But, wean off slowly. And if you try to wean off and you feel like you need a little bit longer, please reach out to the portal so we can kind of give you more of an individualized, am I striving for a different look because I want more of a muscular look, or am I striving for that number on the scale? You kind of got to figure out for yourself, is that, where is my goal at? If somebody has a goal that is too low and they're refilling and they're like, this height and this weight, I will be like, your goal is borderline low. I'd really like to know where that goal came from, and it's hard with telehealth. It is, there's so many things that are amazing about telehealth. But one of the things is we don't get to do that one-on-one,
Right.
So I have to look at somebody on paper and say, you can't lose any more weight. You need to start weaning, where I can't see you, you know what I mean? So having that conversation helps. So, when a provider comes and asks you and says, it's truly because we want to know and we want to, help you reach your goals, but we also want to make sure that you're healthy and that we're not getting at risk of, are you losing too much weight to where we're going to be losing muscle and bone and hair and having health issues. So the goal is not skinny, the goal is healthy. And so we want to make sure everyone can kind of get to that obtainable goal.
Yeah. Let's talk about holidays. So with all of this being said, that we had a lot of questions come in over how do you do all that, but holidays?
No, holidays are so hard. They're so fun. They're so hard. They're all the things. Holiday parties are generally, they're food activities, right? Like Thanksgiving, Christmas, different. Sometimes there's a potluck or, things that are going to come up and that you're going to be, encountered with a lot of things that maybe you've been trying to avoid for the past 6 months because you've been on this journey. So I think really it's about balance.
Yeah.
So enjoy your life and enjoy the holidays and try to have some type of balance. Some tips to give for holidays and food parties and stuff. Reach for protein first. Protein and vegetable and fiber are going to be your friend. You still can have the appetizers, but go for the protein first. So the deviled eggs, the chicken, the vegetable tray. Whenever my friends have a party, I'm like the veggie tray girl, okay? And everyone loves when I bring a veggie tray because I try to make it, like good.
Yeah.
But I peel my own carrots, because I want something that's there that like I know I can nibble on this all night long and feel okay. I still eat the other things, but I try to fill up on those things first so that if I want to have a bite of grandma's homemade cookie that she makes once a year, I can do that and still feel like the sun will rise tomorrow. I did not ruin my whole process. Balancing and having some type of, awareness. So there's a reason that, Mexican restaurants and Italian restaurants put those free carbs on your table, because you reach for that first, you're more likely to eat all the other food later. If you eat the carbs first, you're more likely to eat that later. So there's some studies that have been done on like the way you eat your plate and how much you eat as a whole. If you eat the protein and the vegetables first, you will eat less as a whole in the meal. So that's a good tip. Bringing something that you can snack on and not feel bad about. There's so many recipes with like healthy versions of this that you could do also for like Christmas and stuff. Personally, I always bring the trifle for my family. Thanksgiving and Christmas, I do like a pumpkin trifle and a peppermint trifle. And trifles are so easy to like sneak in healthy things. So I'll make like the pumpkin bread cake part with, less oil or, little things like that where like no one else can tell, but I've, made it a little bit lighter to where I feel better eating it. Yeah. It's also okay to indulge in the real thing. Keep in mind the portion. So this is not the last time you will ever be able to eat this food. It is not. And I'm like speaking myself when I'm saying this. But like having one bite of it, it's not going to ruin your whole progress. Right. Being mindful. Do not go into a party hangry. Don't. If you have a party, people try to save their calories. Usually that doesn't work out really because you're so hungry and you just eat more. So if you're about to go into something that involves food, have a protein shake before, eat some eggs before, eat something with protein to keep your hunger at bay, because obviously most of the people on this call are probably on a GLP-1 or coming on, off a GLP-1. So we have that as a tool, but the GLP-1 is not slapping the pumpkin pie out of your hand, right? So I think it's really important, because this is a lifelong journey for everybody, to, these are the things I can do to help. Aim for the protein, aim for the fiber, maybe bring an alternative, healthier version, but have the real thing in moderation. Have a bite of it. Check in with yourself. Yeah. Do I want more? Or is more going to make my stomach hurt later? Because when I eat sugar on this medication, maybe I don't feel good. And that's how some people feel. So it's really about balance and not beating yourself up too much if you want to enjoy. The other thing is alcohol. Like a lot of drinking activities usually during this time of the year. Kind of being mindful of that. Maybe you could have a wine spritzer instead of the full red wine. That will kind of cut your calories a little bit. So there's a lot of, like tips and tricks that you can kind of just to kind of cut some calories, not make yourself feel so bad about it, but also still live your life, still enjoy the holidays.
Yeah, awesome. super helpful. I just have one from John. He's wondering, what would you recommend for a 3-week international trip? He's not at his goal or in maintenance. Should he bring shots or roll the dice? And
there are plenty of people who have traveled internationally with their shots. I would say bring your prescription with you just in case, like TSA checks. And ask for 3 weeks. I mean, it's really up to you. You would be fine to just go and not take it knowing that probably on week 2, you're going to be hungry. When people bring up vacation a lot, I also like to just kind of say, do you just want to go and not have to worry about side effects? Like if you're somebody who has side effects while you're on the medication, maybe you would prefer to go and be off the shot for a few weeks. But if Jonathan, if you're on it and you're like feeling really good, you don't want to interrupt your progress, then you can definitely take it with you. I think I've seen people with like those like travel, you know what I'm talking about, Dira? Like I've seen some people who pre-draw and they bring their prescription. Now I'm making no guarantee that you're not going to have a TSA person who like, you know, like that's what I would be worried about bringing it is what if something happened? But I think I've seen people who take their prescription with them and so that they can show like, this is your medication. I'm just like somebody has to bring, like you have to bring insulin with you if you go anywhere, right? Like they can't stop you from taking its prescription medication. So I feel like that's really a personal choice. Like, do you want to bring it or do you want to try to just have a few weeks off and not worry about it? Being off for 3 weeks, you're going to probably feel the hunger come back on week 2, 3, but you can always resume when you get home, maybe a little bit lower than you ended off, just to make sure you tolerate getting back on.
Perfect. All right. Well, thank you so much, Maura. You're always so much fun. You are giving our social media all the content. What's probably the other thing? She is our TikTok superstar. You're like, no, don't say that. Yes. You'll see more of Maura because, she's just super helpful and giving us lots of content. So thank you so much. Thank you, everybody, for joining us.
Thank you, Dira. I got to go back and look at some forms.
Yes.
Because the portal's crazy with our Hollandale announcements.
Oh, yes. All of that is all, yes. All right, well, have a good one. Thanks, everybody, for joining us. And we'll see you next time.
Thank you.
Bye.